Kuzazampo and good afternoon to all our viewers in Bhutan and beyond. It is so good to be in your presence today, virtually. And on behalf of the United Nations in Bhutan and the Loden Foundation, I'd like to welcome you to the 27th session of Bhutan Dialogues. Since last month, we have started streaming Bhutan Dialogues online, live on our Facebook page, mainly due to the COVID-19 pandemic and the importance of social distancing at such trying times. But we are also aware that the show must go on, and at Bhutan Dialogues, we are committed to ensure that we bring to you conversations on important topics, on topics that are current and important. Now, some of you may be watching this from isolation from your homes with your families and friends, or even alone. Some of you may be watching this from designated quarantine areas. Some of you may be one of our brave frontline workers, or know someone, or have someone in your family member who are working in the front lines, risking their own lives for us. Some of you may be so zoomed out after one Zoom meeting right after another that you're taking a fresh breath of fresh air. Whoever you are, wherever you're watching this from, we're very glad to have you with us today. We know that all of us have been affected by COVID-19 in one way or the other. Many things remain uncertain at this point of time, and our lives have been changed in so many ways from what they used to be. But nevertheless, and especially at such trying times, it is very important that we get used to new ways of doing things, that we get used to finding new ways to stay connected with each other, and how important it is that we stay informed of all the new developments that are taking place every day globally on the COVID-19 front. Therefore, our topic for today is conversation on COVID-19 and beyond. We are very honored to have two distinguished guest speakers for our session today. We would like to welcome Dr. Rui Paulo de Jesus, who is the representative of World Health Organization in Bhutan. Prior to joining WHO Bhutan, he has worked at the WHO Southeast Asian Regional Office in New Delhi as the coordinator for country support and coordination. He has held several senior positions at WHO and has also worked at the World Bank office in Timor-Leste. WHO in Bhutan has been playing a very, very significant role during these trying times, and we are very honored to have Dr. Rui with us today. We also welcome our second guest speaker for today, Mr. Gerald Daly, who is the resident coordinator of United Nations in Bhutan. Prior to his current appointment, Gerald served as a policy advisor, the team leader of program, joint funding and business operations in UN Development Group. Despite his busy schedule as the resident coordinator, Gerald always finds time and has strong commitment towards Bhutan Dialogue. We also know that UN in Bhutan has done tremendous work in supplementing the efforts of the Royal Government of Bhutan at such times. And lastly but not the least, our host, Lopen Karma Phunso, who is the founder and president of Loden Foundation, a civil society organization in Bhutan, committed to promoting education, entrepreneurship, and Bhutan's tradition and culture. Loden Foundation and the United Nations Development Programme in Bhutan recently supported 10 entrepreneurs who brought practical solutions to challenges posed by COVID-19 in Bhutan. And as usual, at the end of the conversation, we will be taking in questions from our viewers. So if you have any questions, please write it down on the comment section of this post. We have our colleague, Ms. Kinga Ladin, who will be recording your questions, and at the end of the session, during the Q&A session, we will be reading out your questions. Thank you very much, and enjoy your conversation. Over to you.
So Jerry and Rui, if I may, Kuzuzampo, and welcome to Bhutan Dialogues. As Pinso said, we live in challenging times, and it calls for very smart, astute ways of doing business. When the situation holds back, we have to find new ways, even better ways to deal with the situation. And our way of trying new ways is to really do live. This is the second session with no live audience, but live streaming. And this is the first time we are again doing a three-way conversation. Both of you work for the world's biggest development organization, the United Nations. And you have also very deep and intimate knowledge of Bhutan. So normally I ask our guests to talk about their background and then share some anecdotes or episodes that really changed your life. But in today's session, because there are two of you, I thought what I would probably begin with is ask you if you have seen such tragic situations in the past in your long career, and how have you responded to such challenges, and what have you done better this time, or other tragedies that really shaped the trajectory of your life and the future of the world. So really, if I may start with you to share some episodes from your life.
Okay, thank you very much. First of all, good afternoon and kuzuzambola to all of you. First of all, I want to thank you, Dr. Karma, as an individual and also as from the Loren Foundation for organizing this dialogue, which for me I think is my first time, but I really appreciate that. And thanks goes to Jerry for inviting me to be part of this dialogue. So thank you very much, particularly to address a very important subject of today. The other reason for me to thank you is that this event you really implement one of the measures for the prevention of COVID-19, that is physical distance. I think this is great. So thank you very much for this.
Yeah,
Now,
I take note of you saying physical distancing and not social distancing, as you said. I think way at the beginning of the COVID pandemic in Bhutan, we should be socially close but physically apart. Is that what we mean?
That's what I said. I think in my first interview with the PBS, I emphasized physical distancing. Right? Social may have different implications. Yeah. So my background, a little bit, of course, I'm from Timor-Leste, known in English East Timor, a very new country. I don't want to go to that history of my country, but my experience with WHO, I spent quite a lot of time in our regional office in New Delhi, India. So that's the regional office for Southeast Asia region of the WHO. In relation to this event of COVID, since my tenure in WHO SEARO, that's how we call, I've been through several events related to natural disasters in the region, including tsunami in 2004.
In Indonesia.
In the region, it affects many countries in the region, not only Indonesia, but yes, the epicenter of it was in Indonesia. And then not recently, but the Nepal earthquake in 2015, I was there in regional office. And of course, some outbreak of influenza, such as avian influenza and also swine flu. Right? Some experience in emergency situation, as you know, we had. We have a lot of some background of my country. So to cut it short, in 1999, I, together with my other colleagues, we have to reorganize our health system in our country literally from zero. Fortunately, at the time, we get a lot of support from UN agencies, of course, because at that time, Timor-Leste or East Timor was under what they call East Timor Transitional Administration under the UN. The tremendous support came from international communities, including government and non-government organizations. So I learned a lot from those events, both during my tenure in the WHO regional office, as well as prior to joining WHO.
Jerry, yes.
Kuzambola. Before I answer your question, Dr. Karma, let me just acknowledge that our planet has, I wish to mourn the passing of 291,000 981 lives around the world. As the Secretary General said last week, this is the biggest challenge our planet has faced since the Second World War. So these are tough times we're in. And now to answer your question, I've served in a number of disasters, humanitarian disasters, ecological disasters, both in Africa and in Asia, in places like the Sudan, Malawi in Africa, various places around Asia, including Afghanistan, and most recently the biggest one would have been the Gujarat earthquake, where there was a large loss of life. What did I learn? Nobody gets it perfect. You make mistakes. You run out of energy. You're sometimes filled with fear. And I guess the big thing I learned was try and regain momentum. When you fall down, you have to just pick yourself back up. Sometimes it's easy to pick yourself back up if you have good family supporting you, good wife, good kids helping you, uncles, aunts. So those are the type of things that help you out when you're up against it.
Social and community support.
Yeah.
In this COVID-19 outbreak, the UN and particularly the WHO had to play a major role because it was a health crisis. It has, I'm sure, done great work. You can share that as well. But it has also gone through quite a lot of difficulties, even difficulties in maneuvering politically between powers like the US and China. If you were, I'm going to ask this question to both of you, if you are the Secretary General of the UN, or if you are the Director General of WHO, what do you think you could have done differently and better than what's happening right now in terms of the response?
Okay.
You can start.
Okay. Thank you very much. Dr. Karp, this is a very tough question. But let me look at it this way. I would a little bit try to rephrase what you're trying to get out from two of us. What or how WHO and other UN agencies so far have support or are supporting RGOB in dealing with this emergency.
Yeah.
COVID-19.
I must say.
Yeah.
Let's start with the bigger picture.
I will start with the current response. Okay. Then I will take you back to the cooperation that we have with the RGOB prior to this event. Right? And then I will look at what are the lessons we have learned. Now, what are the core of response in Bhutan? Right? Number one is that the coordination level, right? The coordination of Ministry of Health and the whole of the government, and then they decide and take action on a timely manner. That is the key for it. If you try to recall a number of press releases from the government, as soon as the endemic was announced, the Ministry of Health and the other agencies related to health, they immediately took action, including looking at, hey, how far we are prepared at the airport. Right? So that's what they are doing. Huh? And then the second thing is that they know where their experts are. You see, in the team, if you notice, the TAG team, Technical Advisory Group, consists of all Bhutanese. They are here, but probably good thing is that the ministry knows where they are. Then we immediately establish the surveillance system, including early detection of the cases, realizing some limitations that we have. Please highlight, this virus is new. So there are many things that you have to start building your capacity on. including the clinical management. So what immediately the government was doing was to prepare their human resources to respond to it. Now, if you look at the publications or some press releases, oh, in Bhutan we only have, very limited doctors specialized in responding to emergency situation. Now, what they do is immediately they conduct trainings, right? So that's how they overcome the situation. And then prepare the isolation room, right? And then coordinate with other relevant entities or ministries from government and also non-government agencies in the country. So these are immediate things that we are doing. And of course, among other things also, immediately coordinate with agencies including WHO and my colleagues, other UN agencies in the country, right? So this is where we achieve or where we are at the moment, right? Now, if you look back, the government is, I think, they have prepared themselves for this kind of events, for outbreak of diseases like this, as well as natural disasters, right? Now, let me start with what happens in the UN. We have, under the leadership of Jerry, we have what we call interagency task team for emergency, right? So that is to liaise with the government, to assess the situation, to look into our own capacity, how best we can support the government, right? Now, from WHO side, I'm coming back to the airport. If you, I know that you've been traveling, so that thermal scanner there is not only for that. That was our response to preparedness response to the Ebola. So we have there for several years already. Right? It's already there. Maybe it's hidden somewhere, but it's working. Okay. And also in the end of 2017, we conducted what we call a joint external evaluation for the implementation or our capacity in International Health Regulations 2005. Right? There are three main components of the evaluation. Yeah? Number one is to prevent, number two is to detect, and number three is to respond. All these three, there are 19 components that we assess at that time, right? Of course, I don't need to go into the details, but the scope of that encompasses policy down to the implementation capacity, okay? Now, I mentioned in my introduction about the tsunami, right? As a learning organization, WHO, I think quite old, more than 40 years old now, but we are still learning. Now, out of that tsunami, we learned several things, of which, I refer to WHO as your secretariat, as member state and member state of this region. We learned a number of things. Number one is that from there, we establish what we call the benchmark to assess how ready a member state in this region is to respond to this kind of event, including natural disasters and disease outbreaks. So we prepare that. Number two, which we make use of it this time, is we realize that in order for a country to release money for an immediate response to emergency like it will take time, right? Then you agree with me. So that's then we member states of this region agreed to establish what we call Southeast Asia Regional Health Emergency Funds, of which an amount of 175,000 the regional director can immediately release, literally no time, upon my request, or request from the government through me, and then SW1, I report to the regional director and the regional director will release immediately for immediate response. So these are a few things that if I go back to the preparedness, if you see what we call MCK, that is medical camp kit, we learn from Nepal.
But what I actually I think when I ask the question is not to discredit what has already been done by the WHO, the UN, or the RGOB, the government of Bhutan, but with all the gratitude and the appreciation of what has been achieved, when you look at the COVID situation with hindsight, we have lost, as Jerry pointed out, almost 300,000 lives. What could have the UN and the WHO done differently to save those lives? So it's not really to say people didn't do enough, but we always have room for improvement. So the future, what have we learned to make our service, our interventions even better?
Okay, so as Dr. Rui said, this is a good question. So here's a few things. The United Nations lives in a world of nation states. So nation states always have primacy in decision making. But most people would agree that the Security Council over the last 7 to 8 weeks has not been as effective as it might wish to be. So we have to try and find a way to ensure that the leaders, especially of the Permanent Five, take on the responsibility of being members of the Security Council. And for example, why has it taken us so long to agree that a ceasefire should be happening across the world today? This doesn't make sense. So most people who are looking at this objectively can agree a ceasefire, military ceasefire, should be happening all over the world. So that's one thing where I think we can learn a lesson.
But the UN as a whole is handicapped to really make that change.
We are handicapped because the member states, especially at the realpolitik level, at the highest levels of politics within our world, have decided that they don't actually want to work together on a global ceasefire. That's number one. Number two, the United Nations is an important player in development, but the international financial institutions are even as important. We need to have a closer relationship between the international financial institutions and the United Nations so that we're able to target resources faster. Third example, over the last 6 weeks, the United Nations has been able to bring in 140 million Nultron into this country, additional resources, additional grant resources. The United Nations and my office should have greater capacity to bring in more resources. We should have essentially what could be called drawdown rights, so that we're able to help countries that require it. Especially, I would have to say, LDC countries. LDC countries, lesser development countries, deserve extra priority at times of emergency. So those would be 3 things I think a Secretary General would agree with.
Yeah. So let's narrow down now to your role here in Bhutan as head of UN and head of WHO. First, a very straightforward, easy question. Bhutan has done relatively well, in fact amazingly well in terms of COVID response, and you have been part of it. But is there still any room for improvement? Do you have any thoughts in your heads going on which the Bhutanese audience must hear to make this better?
Allow me to acknowledge what Bhutan is doing. Number one is leadership, right? That contributes a lot to where we are now in our response to COVID-19, to protect Bhutan and Bhutanese from COVID-19. I should mention here that leadership and the guidance of His Majesty, of which I'm privileged to share a building with the Ministry of Health. Physically, His Majesty is there with Ministry of Health and all the components in the Ministry of Health to guide them to respond to this situation. Secondly, of course, I have to mention here the leadership, the technical know-how of both the Prime Minister and our Minister of Health. That gives a very clear guidance for all components in the country to respond to COVID-19. Your question is a little bit tricky anyway, but let me start by saying, when I try to elaborate about the preparedness, this is what WHO and UN as organization of member states consistently advocate our member states to invest in that area, right? So this is, if we invest more in the areas of preparedness, definitely we'll be able to respond much better. I mean, I try to generalize not only Bhutan, okay? Of course, the other response, which I fully agree in our meeting with Director General as well as with the Regional Director of WHO, Honorable Minister of Health, Lombo Dechen, consistently mentioning about humanitarian corridor. Now, why I say this? You look at the situation now. Huh? We don't produce reagents for lab tests, right? We do not produce particularly little bit high-tech N95 face masks, okay? That means we depend on other countries. If the corridor is closed, you can imagine what is going to happen. Fortunately, at the beginning, because of the level of alertness of the system here, we are able to provide whichever we can from the regional stockpiling and also from the global stockpiling. We are able to mobilize, at least we are able to provide adequate PPEs for our health workers as until today. So this is the situation. So if we invest more in preparedness, right, then definitely we'll be better off, right? So these are things that we consistently try to
I'd like to come back to that question of preparedness and health facilities here, but moving on to Jerry first before that. Bhutan has done well, and thanks to the leadership one, and also there was recently an article in the Diplomat about how the sense of community solidarity has contributed, from farmers contributing cabbages for food in quarantine centers to hoteliers providing free accommodation, all the way up to the Prime Minister and the Health Minister and His Majesty working on this. But although we have done so well right now in physical distancing, in securing our borders and so forth, as this situation drags on, I sense some complacency, people getting tired, fatigues sinking in. You are an expert in resilience. How should people sort of work with their mind now to continue with that same persistence? I think a lot of people are going through a kind of COVID fatigue now.
Okay, so I certainly want to compliment the response that this country has been moving with over recent months. Almost impeccable. I would especially like to highlight the non-politicization of COVID. This is something that not many people take note of, but when you see what goes on in other countries around the world, the non-politicization of COVID is almost exemplary. In terms of what we can do, perhaps slightly different, I would say identify the opportunities that have been under-tapped. But we see, so for example, we see that there's plus or minus 50,000 workers from India who often are working in Bhutan. Many of them are returning home. We see that in Build Bhutan project that this opportunity is already being tapped. And that's something we have to put even more energy into. A second opportunity for me is looking for opportunities to bring the CSOs into play. I have a lot of respect for the CSOs here in Bhutan. I believe they are often small and nimble. And that, what I know from other disasters, when you are small and nimble, you can move fast. The last point, it seems very clear to me that in general, those people who are retirees here in Bhutan are an untapped, often an untapped resource. So what I would like to do in an ideal situation is I would like to link those retirees with some of the students that have returned back to Bhutan, plus or minus 5,000 of them. So we can see this as a learning opportunity to marry or bring together the retirees as mentors with these 5,000 students, plus or minus 5,000. In terms of resilience, you're absolutely right. We are going to have to tap even more strongly our skills on resilience. We know that His Majesty speaks about the 5 excellent qualities of the Bhutanese, S-M-A-R-T, R standing for resilience. So we know that this is a value that's greatly appreciated here in Bhutan. So we have to support the work of Dr. Chencho and his work in psychology and mental health, but we also have to find ways through the social media and the media itself to support what I would call role models, Bhutanese role models. And interestingly enough, those Bhutanese role models working in the health sector that Dr. Rui spoke about earlier on, don't only work here in Bhutan. There's a surprising number of Bhutanese working with the United Nations across the world. 5 or 6 days ago, I got an email from a lady called Yeshi Zangmo, who works in Goma in Eastern Democratic Republic of Congo. These are the type of role models we can celebrate even more than we currently do.
Thank you. Let's talk about going forward. Bhutan has done wonderfully well in terms of sealing the country, protecting the country from COVID impact. But then we can't go on like this. This is one of the most complex problems with implications on all sectors, all aspects of life. So there has to be an exit strategy, I suppose. And when you look at how we've dealt with COVID, with all the due gratitude and appreciation of the strategy so far, this is a personal opinion that I've actually, something that I've learned from a colleague of mine, about how we have implemented a uniform, one-size-fits-all approach in locking the whole country. But do we have to really close down a school in Lunana and Laya, just as we have to close down a school in Pinsori? What kind of strategies do we have to get out of this current situation? Should we go for a more differentiated, targeted approach? Because herd immunity is basically out of question here in Bhutan. Do we have the health facilities to cope with a sudden burst of COVID cases, say when we open up? The number of ICU beds or ventilators, how are we preparing for such an exit?
Well, again, this is a good question, a very technical question. Let me start, before I go into the detail, with 2 points. Number one is that physical distancing, closing of borders, air and land, are not the end of it. These are means to achieve something. That something is to prevent transmission within the country. That's point number one. Point number 2 is that we need to bear in mind, it will be better. It is better to overdo it than, underdo it. Yeah? So these are 2 things that we need to bear in mind in discussion about these kind of actions that has been implemented or taken by the government, right? So, as a means to achieve or to prevent transmission, let me give you some secret in the factory in the Ministry of Health. So people, what we feel as member of community is that, okay, government has implemented restriction of people's movement. But the factory there in the Ministry of Health is very, very busy. While taking the advantage of that to delay, in case, the transmission, they are working on what? Preparing the human resources, preparing the supplies, including how to protect our health workers from, getting the infection. I think you know the figures, how many health workers in the world they are victims of it. And prepare rapid response team, right? And many other things from health perspective. Now, not only health, but the government as a whole, they are preparing other aspects of life, right? Including the education, including the agriculture, and so on and so forth. So I call it factory, or the kitchen is very busy. So once, as you said, people are complacent on this situation, once we have to, give back people's normal life, then we are ready for that. That is or WHO, we may call it, we buy the time to prepare ourselves. This is exactly what Ministry of Health is cooking, or whole of the government is doing. So,
and in your analysis, how far are we from that ready state?
Okay.
Weeks, months?
I think in terms of readiness, first of all, you need to look at the capacity of each country. Let me put it that way.
But Bhutan.
Yeah.
In terms of Bhutan.
That's what I'm trying to build my argument. With the resources that we have, right? With the physical or geographical, demographical condition of the country, socio-economic aspect of the country. As WHO, my question would be whether we are going to have case or not, but whether we are ready to respond in case there are cases in the country. So if you ask me, at this stage, I can say that Bhutan is ready to respond to that.
That's very good news. It is.
My view is that we have to be very clear that we are guided by a vision, that we wish to save lives. So that's a very specific vision, and I commend that vision. So then we have to align with that vision in terms of follow through. That's number one. Number two, you spoke about herd immunity. Just today I took notice of the fact that Singapore does not believe in herd immunity. It has written it off. Number three, I believe in terms of the current procedures, we are following appropriate procedures, and I would say we need to be keeping an eye on smart countries and how they are responding to either lockdown or partial lockdown. A good example of this we see happening in the Republic of Korea, South Korea, and they are really ramping up on testing so that they know where there are impacts. And if they see any spikes with cases, because they're doing a lot of testing, then they're able to immediately close things down very, very fast. And I think this is all then going back to the start of the circle, that we are valuing every human life. And I commend that vision.
But even considering human life, one of the things that I'm worried about is with this COVID pandemic, it has drawn all our attention, and we are overlooking many other problems that we always used to face. Bhutan almost lost one life every day to alcohol-induced diseases. Today we are so focused on COVID, we don't properly realize, or are we accounting, are we really aware of the impact it has on the economy and many other sectors, but also on life? Because I've heard about two stories of people having to return from India where they went for treatment. They returned because of COVID and then they died. Their death was not from COVID response. So how can we also think holistically, without being too focused on just one single problem?
Well, again, it's a very good question, and I think very well researched.
That's anecdotal.
The strategy or the policy of the government and also the guidelines from WHO, we have two things we have to handle at the same time. Definitely, COVID-19. We need to prepare, we need to take actions and how to prevent, and then, all these things. At the same time, we need to ensure minimum disruption of the day-to-day health care services to the people. Now, I'm happy to inform you in Bhutan. In fact, for your information, the health secretary has been assigned exclusively to ensure the continuity of the regular healthcare services for those with non-communicable diseases or communicable diseases. So we need to make sure that, as you know, this is rainy season. If you recall, last year we have a lot of cases down there in the bordering areas, right, of dengue fever. We are working on it, and we as partner, we are still working with the government to ensure that these services are in place, right, and the activity is going on, right. Other thing, probably just to pick up the examples also on the water and sanitation, right. You may link this with the COVID-19 as well, but we are working on it. We are now doing an assessment, what is the level of water and sanitation provision at those health facilities in particular. So regular or routine programs are also, we are working on them.
I want to go back to preparedness and health and get your honest opinion. You may wear the UN and WHO cap or not, up to you, but when you talk about the health system here, we don't have private practice in a full sense, and there are some private diagnostic centers, but then there has been a lot of debate going on among the public at least. Some people are actually so frustrated that there isn't a private practice system where they can demand the kind of service they want. And tens of millions of dollars going out of the country for special treatment to India or Bangkok. We have our own dentists practicing just across the border because such practice is not allowed within the country. So your personal opinion, you can make it the UN official point as well, but should Bhutan have more private medical practice to supplement the public service?
Right. Let me start this way.
Well, I asked this question partly, because His Majesty has, during the last National Day, ordered the government to come up with a 21st century economic roadmap. And I think health is a very important part of that.
Correct.
And health, maybe health tourism, wellness tourism to Bhutan could in fact boost the economy as well.
First of all, I'm happy to hear kind of very good information from you that people are talking about it. That's exactly the point that I wanted to make, but you mentioned already that people are talking about it. My next point is that in any given country, any given health system, a good health system is a system that will be able to cope with the situation at a given time, right? Now look at the epidemiological challenges. Despite the fact that we are still fighting with a number of communicable diseases, COVID is one of them, of course, and then TB and dengue fever. to name a few. At the same time, we are facing with the fact that the number of non-communicable diseases, including hypertension, diabetes, cancer, right? We have to handle that. The one way to do it is that we need to equip, update our system to be able to respond to those situations, right? Now, the contribution of private sector. Now, we always look at the contribution of private sector by saying that, okay, it will be nice if we have private clinics. It will be nice if we have private hospitals with the very high standard, right? But we need to also think, before coming to that, their contribution in another way. For example, their contribution in health promotion and prevention. That's something that we must take from them, right? For example, okay, we can, and I believe that they will be happy to if we provide or allow them to contribute. Occupational health. There are many diseases resulted from unhealthy working environment that they can contribute, right? The mental health of their staff or their employees. This is something that we can request them to, contribute to that. Ensure that their workers, the health of their workers are, checked on regular basis, and make sure that they provide also recreational kind of, facility for them to, if you do all these kind of things, believe me, their productivity will be higher, right? Now, coming to what I know, your question is about private practice, right? So, what I wanted to say is private practice is just one of the many contributions that we can expect from private sector. That's the point that I wanted to convey. Now,
but would you recommend that to the government, for instance, as WHO
exactly.
president? Okay.
Exactly. Now, coming to the private practice, right? As I said, we need to continuously look at our health system from, the scope and range of the service. I have described already why we need to do that. And the fact that you've just shared that millions and millions of
dollars
spent by Bhutanese to, seek healthcare services out of the country. At this stage, I should say that there are commendable mechanisms in Bhutan. Number one is that Bhutan, Health Trust Fund. This is something one of its kind in the world, I would say. And you can blame on WHO. We are part of establishment of this Bhutan Health Trust Fund, right? This is a very innovative thinking, right? Now, how far we can go, right? And I think the time is right for us to think about giving options to people, right? And then I'm happy to hear that people are talking about it. Allow people to talk. I believe when you give them enough time, they will be able to come up with a good formulation and allow our policymakers to come up with a proper policy on how we can introduce new mechanism into the existing health system.
I'm with Dr. Rui, and I would add the following. I would frame this question within the overall ambition on self-reliance. When we have significant monies, hard-earned monies, going to countries like Thailand or any other country for high-end healthcare, then you have to wonder, how could we find a way to be more self-reliant? So I would frame it within self-reliance. The second point I would make is that we need to be very clear and much more transparent about how many people are going out and how much it's costing. So then we can actually understand the dimensions of the issue. And the last point I would say is that from my perspective, at this point in time, it deserves additional research. So let's try and open it up for some very smart analysis, quantitative and qualitative, and on the basis of that quantitative and qualitative analysis, then we make the decision. Again, a lot of these things come back to common sense.
Yes, I think we should have more of that evidence-based approach. I have many questions, but I think we have only a few minutes left between ourselves. But I want to throw you through this big question to two of you. When you look at the global situations right now, and look at the pattern of COVID impact, it's Western Europe, Scandinavia, North America, Far East Asia, which have actually suffered the highest, greatest ravages of COVID. Third world countries actually, so far, have not really suffered as much. And we are all here working for development, always aiming to reach the OECD level, leave the least developed countries there. And then when you look at also the social, moral response to this whole thing, there's much more bickering and side-taking and racial prejudices going on in these developed countries. As you know, America is full of that. Every day you hear, right from the leadership, a lot of ugly things. Asians, for instance, being associated with COVID and being discriminated against. So, where has humanity got to? Where is the development trajectory going forward? I mean, should we really aim to be in the OECD country group, if that's where we are going to be morally, socially, and health-wise? Has this situation made us rethink about the direction of development, Jerry?
Thank you. Number one, the emerging view within the United Nations is that we have to lower our appetite for GDP growth, and we have to increase our commitment to social inclusion. Now, those are very big sentences, but what it basically means is that making sure that the whole country is benefiting from any type of growth makes maximum sense. So that's a distinct shift. So this idea that economic growth had become some type of a deity, we need to shift away from that type of thinking and think about inclusion. The second thing is, the more societies are understanding the value of supporting the vulnerable people within their countries, the more you are able to see a society that works well together. That often seems to be happening in Asia. The third point, 4 points. The third point is, keep an eye on what some smart countries are doing in terms of development. Even in the midst of COVID, South Korea at this point in time, they had an election approximately 3 to 4 weeks ago. And they've already made a commitment on what they are calling a Green Deal. So they're thinking, even in the midst of this disaster, how can they turn it into an opportunity? You mentioned earlier on that Bhutan is talking about an economic a roadmap for the the 21st century. That's similar type of thinking. So even as you are focused on the now, you're able to be thinking into the future. That for me is smart thinking. The last point I would emphasize in terms of the test of humanity, we don't know how long this is going to last. So I myself am shifting away from optimism and pessimism and shifting more towards determination. And that determination often revolves around values. So you agree on your values and you use your values as your guideposts, as your signposts. So shifting away from economic growth as a signpost and shifting more towards values. I think there's a lot of sense in that. For me, at this point in time, as the leader of 26 UN agencies that work in Bhutan, but especially the 7 that have people on the ground, including WHO, FAO, UNFPA, UNODC, UNDP, UNICEF, and WFP. These are the agencies every day, every week, every hour who are working for this country. And I hope that values will be driving the work of the United Nations, not just during COVID, but going forward, right into the 21st century. And fortunately, here in Bhutan, we have gross national happiness as a guidepost. So we're doing a lot of things right, as far as I'm able to see.
Can I add?
Yes, yes.
Number one, we need to bear in mind this is a completely new virus, okay? Of which I would say it is too early for any country, any entity to claim that they have successfully, controlled the virus, nor we can point our finger that any country, any government has failed to do so. We need to bear this in mind. Now, coming to the gist of your question, for me, it's not about a country is well resourced or less resourced, but it's the issue of your being able to utilize the resources that you have in country, tapping the potential that you have in country, and your ability to tap or to seek or to strengthen or to build upon your existing collaboration with other agencies that will help you in this case. And I think I mention this because this is what is happening here. As I said, we cannot claim anything at this stage, but as of now, I think what we are doing, we are hitting the right path.
But when you look at humanity as a whole, one of the things that people have been talking about is we live in the era of big data and immense technological advance. We're even naming exoplanets now. But yet we have to teach people how to wash their hands. So what's humanity's progress rate like?
Look, I think in one of my interview I mentioned that these preventive measures are not specifically advocated for COVID-19. These are in fact a reminder that if we practice healthy lifestyles, including this hygiene, practice as simple as hand washing,
which is yet difficult to.
And also I mentioned in one of my interview, please observe the healthy lifestyles, including 4 main risk factors for non-communicable diseases: tobacco and tobacco products, use of alcohol and other substances that may harm your health. Physical activity is also important, and also last main risk factor is diet. So if we can observe these kind of things in our day-to-day life and add on some these basic hygiene practices, hopefully we'll be blessed and we'll maintain a healthy life living.
Well, with those wonderful advice from Rui, let's now turn to the audience. I'm sure they have lots of questions. Finga, if you could read out the questions, please.
This question is from Suki Zammo. For now, like most countries, Bhutan seems to fall focus only on short-term immediate actions with targeted benefits to minimize negative health and economic impacts, but the discussion will soon need to be moved to long-term management of the increasing public debt that our country is bound to face due to the fiscal interventions made. It may be time to start thinking about practical solutions to introduce simple but temporary measures to ease this burden. Would the panel have any suggestions on such measures based on the past pandemic outbreaks?
There are not multiple, right? You more or less want about
Only one
not
question?
focusing just on short-term response, but about long-term debt and other issues. Any suggestions?
Okay, so Chuki, I certainly agree that we could be facing into the light at the end of the tunnel may not come soon. So we have to have that ability to think, how do we make sure we have the resources that are going to get us through this period of time? Now, what's very interesting about this fiscal question that you're asking is how some Western countries are approaching it. So, for example, we see in the case of the United Kingdom, they have already made a commitment to extend financial support essentially to all workers until October. So they're seeing the importance of ensuring stability as being more important at this point in time than fiscal rectitude. My sense is that probably is a good decision right now. In terms of where you can make additional savings, earlier on Dr. Karma was speaking about what is called the economic roadmap for the 21st century. There are 4 different bodies of work going on within that process. One is led by the executive group, former civil servants is another group, the private sector. And what we see, and then there's the development partner group of which I am a member and leader. What we can see across those 4 different processes, as many as 300 recommendations are coming through. Those recommendations need to be assessed by the members of the task force, of which Dr. Karma is a senior member, Kinga Sering is the chairperson, and Bhutanese people then need to do a good quality analysis of those decisions and come out with what they believe to be the best, and they would then go to the government. And that for me is the smartest way to use our scarce resources at this time.
Do you want to add?
I think I have maybe indirectly answered to this question. As I said, whatever restrictions being put in place by the government is not the end per se, but it is to achieve what we want to achieve, that is to prevent this disease to spread in the country. At the same time, it is the way, or to allow the government, and the response to this, not only the government, as we learned in Bhutan, but the whole of society, the whole of government, to be able to strengthen themselves to respond to COVID-19. So this is the situation right now. I can understand the question, the level of frustration that we have, but I think we need to understand. The question would be, the right question would be, what if these measures are not being imposed by the government? Imagine that way. Okay?
Well, at least in Bhutan, we don't have people going to protest with guns saying economy matters more than health. But I think Soke asks certainly a very, very important question. And this time is a very good period to us. I think COVID has given Bhutan this wonderful opportunity, this window opportunity to reevaluate how vast health, economic, all policies and practices, and then find a new direction, adjust to the new normal, as people often say. I think, as Jerry pointed out, one way is to really thrash out what economic direction Bhutan wants to really follow from now on to overcome issues like this enormous debt we have. But add on to that even more serious cases, the outflow of human resources, young people in droves going out to places like Australia. We need to address that, and economic solution is the only way to tackle with that, I suppose. For the public, I normally say it's okay, and this is one thing that I've been promoting the past few years. When we think of debt and the economic stability, there are two things we need to keep in mind. One is production, and the other is consumption. Our production has to really be boosted. I mean, we are not as productive as we used to be 60 years ago in our grandparents' time. So we certainly need to produce more than what we consume. And our consumption has shot through the roof. We are consuming 10 times more than our grandparents today in so many different ways. So at least we need to really balance those two. Consumption, of course, feeds into production as well, because we live in a market economy. But one specific thing with regard to consumption that I really like to highlight to the Bhutanese public and the young people particularly is waste. We certainly can do a lot more in minimizing waste. We can have a sustainable prosperity, enjoy our life as much as we can without having to waste. Switch off the light when you leave the house. Don't leave food unnecessarily on your plates, no? Half eaten or a quarter of it uneaten. I think we can do much better in reducing our financial burden and dependency by producing more. And I think a lot of young people these days are so keen on taking up agriculture, which is wonderful because we are importing so much otherwise. And then I think we can also reduce our consumption, especially in terms of waste. No? So I normally say we have to have an empty plate policy. Whenever you eat, have your plate empty. No leftovers or no unused food. Of course, if it's leftovers that are unedible, that's fine. But if there's an edible food on the plate, I think it's morally unjustifiable.
The second question is from Sandra Shetri, and the question is divided into two parts. The first one, praises to our king and the government for tackling the COVID-19 issue. How would you advise the economic movement during the COVID-19, which we understand may continue for a year or so? The second part of the question,
Economic movement, you said?
yes, economic movement. And the second part of the question, Bhutanese may also soon get into the conspiracy theory of how vaccines will be designed. How would you advise the nation on this front?
So, Rui, I think you'll have to go with the second question. Now, is there some serious conspiracy theory that we have to be aware of?
As of now, at least today, this hour, I have not seen anything that drive us towards believing in conspiracy theory. Okay. As a nation, my advice is let's look at what we can do to protect our people. Probably we should not waste our time wasting our time to think about something that is not sure out there.
Dark imagination.
Dark imagination. So let's concentrate on that. Now, coming to vaccine. I don't want to sound either too pessimistic or too optimistic, but I want to be realistic. In fact, in order to produce a vaccine any kind of vaccine, it will take a lot of time because it has to go through a long process, right? So I don't think it will be here within short time. It will take time. That is why, let me repeat my advice, is that please bear with us, practice the preventive measures properly. That is the best we can do. Allow the government and other agencies, national agencies, regional and international agencies, to work to make sure that we are protected from this disease. I know they are trying their best. We are all trying our best. But we alone cannot do much. We need you, each and every one of you, to come together, hand in hand. I've witnessed in Bhutan, but let's continue that work, collective work. You do your part, we do our part, and that I'm sure you will come with a success story that will be able to control this virus.
But is the part that the public has to do to basically trust the government and WHO on which vaccine is right?
You have all the right to ask questions, yeah. But as I said, your job would be at the individual level. Practice this. Wash your hands properly, yeah. Yeah? Because I see many people also wash their hands, but because they are, in a hurry, they wet their hands, not wash their hands properly. I think you have leaflets here and there, everywhere in TV, radio, talk about proper hand washing, right? Yeah? Unnecessarily touch your face. So, and then physical distancing, right? And as I said, practice healthy lifestyles. With all these things, we'll keep ourselves safe and protected from COVID-19.
And then Mr. Chetri's question on economic movement. I'm a big believer in what I call smart self-reliance. Smart self-reliance. So let me give you two examples of what I think are smart self-reliance. I'm interested in smart self-reliance that doesn't incur heavy expenditures in the future. But so you're able to do an expenditure in the short term that saves you money in the medium to longer term. An example of this is solar panels. Makes a lot of sense to me that we can invest, we can strengthen our small-scale manufacturing capacity and put more of our resources into solar panels, thereby creating energy that's free, essentially. So here you have UN House. We operate at, I think it's about 35% of the electricity at UN House is coming from solar panels. Makes sense. This is an example of smart self-reliance. Another example, last week FAO and the Ministry of Agriculture started small-scale vegetable production in peri-urban in Babesa. I think it's about 60 people and about 5.5 acres. We should create more opportunities like that so that householders, even living in the Thimphu area or other urban areas of Bhutan, can already start producing their own vegetables. It may not be 100% of their own vegetables, but it can be a start. Those are two examples of what I'm talking about, smart self-reliance.
The third question is from Nima Yonzin. COVID-19 has now become an alarming pandemic around the world, and China has already started acting unpleasant in many forms. That is, virus is already threatening the world and border disputes are occurring simultaneously. So what I feel is Bhutan shares its border with China, and we have dual concern about the virus and the border safety. In this regard, please share your view.
I will talk about border. The government last week they came back, sent 4 teams to assess the border, not only from the Ministry of Health and WHO, but also from other, agencies like RDP, RBA, and then the volunteers, the soups, and so on. they have assessed. They spent 2 weeks in the field, all the land borders, right? They have assessed. And also the assessment, they know the situation, then the actions was they have established teams there which consist of different personnel from different agencies to take care of the border. So I think that's why I said at the beginning, or one of my statements, please allow the government to do these kind of things. These are legitimate questions, but because I know what is happening, that's what I can share with you. Probably this question is more appropriate. You address it to the government. I know what the government is doing, which is commendable. Now, as I said, in the worst case scenario, the government is in fact has prepared how to respond to it, right? So this is. I hope this will give you some assurance that plans are already in place.
I may add something to that. The question is more about China being the origin of COVID-19 and then the border with China. Unless the cordyceps season that is picking up now exposes people to more exchanges with the north, so far our borders are generally quite sparsely populated. There's not as much risk to the north as there is risk to the south. So I think the border with regard to the south, with India, is much more risky. And in this respect, although I would fully agree with you in saying that we should let the government do it, I think there is a lot of responsibility that the public has also got.
Definitely.
That each one of us, we have our own relatives, our friends, our villagers, and we, I think, should inform them, discourage them from sneaking across the border to buy drugs or buy tobacco. I think this is something only a whole of nation approach can deal with. You can't leave it just to the government or the police. These miscreants will continue bringing in viruses and other unhealthy things. So I think the public has to be much more careful.
When I say the team in those areas, not only consist of law and order bodies in Bhutan, but also the local community. So, as I said, I mean, the cooperation, collaboration at the community level, at the individual level, are crucial. Yeah. That's what I wanted to add. Yeah.
Thank you. Another question is, I think we can take a few more.
The next question is from Sokizamo. Plan A seems to be a successful development of a vaccine, but in case a vaccine does not materialize, what would Plan B be? Globally, I notice millions of dollars being spent on trials for a vaccine, and rightly so, but hardly any being spent on non-drug interventions like right use of masks, right material, etc. In case Plan A does not work, shouldn't countries start spending on non-drug intervention studies? For instance, there is still no consensus on whether a mask is an essential wear. Likewise, the number of times hands should be washed, the peak hours it should be washed, maintaining a social distance. Research on drug interventions is still poor. Shouldn't countries spend on such studies in case vaccines take time, or even worse, it never materializes?
So, Plan B.
Okay. I think this is a long question and different dimensional aspects of it. But let me pick up one of it, which is very important: the use of masks, right? And I just want to limit to the situation in Bhutan. Okay. As of today, we have how many cases? 15 cases, right? The first case was identified within, let's say, within the country, okay? But the response team reacted very, very, very quickly. Yeah? It was identified in the midnight, and the next morning, 6 o'clock, all the contacts, first, secondary contacts, have been identified and take actions accordingly. They were quarantined and tested and so on, right? Then, as you know, no more cases out of that if we consider that as index case, okay? The rest of the cases resulted from quarantine mechanism, the facilities of which prepared by the government, right? That means we have developed or put in place the barriers before the virus come in contact within Bhutan, with the people inside the country. Let me put it that way, if we consider it's a barrier. For Bhutan, I do not say you should or should not, but I think we are at a relatively safe at the moment, as epidemiologically there is no evidence that there is circulation of virus within the country, within the community, right? Now, the question about the mask, we need to be very, very careful, because most of the time, number one is that when you put mask on, anything foreign to your body, you will, at the beginning, you will feel really uncomfortable. What you do is adjust every time without washing your hands. That means what? I said, don't touch your face unnecessarily, right? Second thing, you will feel a false feeling of security, right? That is another thing. People, okay, I can go, I can hug, I can, forget about social distancing. Now, so I will be very, very careful in advising the use, particularly given the current situation, current epidemiological situation in the country, right?
So that doesn't feature even as plan B then?
Well,
it's good to have, but it's not really, it shouldn't really feature as a major plan to protect people from COVID.
I mean, then if you see, as of now, even I believe, I know we don't have much time, but we may, when we think about COVID, we may think about this situation in Wuhan, we may think about this situation in Italy, we may think about the situation even in the US, New York, right? Now, what is the differences, right? Look at the, the residential areas, or the part of town, the busiest part of town in Bhutan. I can say 2 towns here, or 2 cities. Capital Thimphu, but at the center of Thimphu, and probably Phuntsholling, right? Apart from that, you see how, the houses here, they're far away from each other, right? That is one of the advantages that we have. So, number 2, if you look at those countries, the proportion of people, the old people, above 60 years old, much, much higher compared to Bhutan, right? So if you look at many other aspects of it, I'm not saying that Bhutan as a country is immune to it, but as of now, I believe that the impact of it would be much, much less compared to those countries, provided that we work together, we practice all the preventive measures as advocated by the government, with all these things.
Soki, thank you for this specific and detailed question. Here's my current view. We as Bhutan don't need to learn, we don't need to make mistakes ourselves. We can learn from the mistakes that other countries who are ahead of us with COVID have made and are learning from. So, for example, as I mentioned earlier on, there's mounting agreement now that herd immunity is not something to be relied upon. So we shouldn't see that as a plan B. Another example is good examples coming out of South Korea and other countries. For example, Austria, Germany, do lots of testing, as much testing as you possibly can, so you're able to catch it and nip it in the bud, should it ever happen. So to summarize my point here is, in terms of answering your question, in terms of a plan B, let's keep a close eye on international good practices, and as much as possible build upon those good practices on what we do here in Bhutan.
Thank you. I think we have run out of time. I'm sure there are lots of questions, but I'll have to end the session. But before I let you go, I have my final question for you. This is going to be in continuation to what Tsoki was asking about plan A, plan B. I in fact would reverse the two and say plan B that she suggested was more like plan A, and vaccine is something that's yet to happen. Maybe even plan C, not necessarily even plan B. But one thing that we can count on, it seems, is if you have a strong immune system, this COVID-19 has not been able to penetrate into the human system. So a lot of people who have strong immune system are doing well, and you have given plenty of advice on how to go about protecting one's system from unhealthy substances and behaviors and so forth. I think here in Bhutan we are lucky in a way that we have our traditional indigenous medical system, which also does a lot of work and brings out lots of medicine that can boost the immune system. But two of you, what do you do in your personal life to boost that immune system? If you can share with the audience. Jerry, you want to go first?
There's a couple of things that I'm doing on a regular basis. I'm spending as much time as possible in nature. I'm going for a walk at least once every second day, so that I get out into nature and I'm able to appreciate the benefit of living in such a pristine and pure environment. So that's an easy win. I think the second thing that I'm trying to do, perhaps my wife Celine would not agree with me 100%, but as much as possible, I'm trying to get along better with people. I'm trying to listen more and recognizing that many of us are living through tough times. We could have a relation, we could have somebody else who's been affected by COVID. So cut them slack. So cutting people as much slack as possible and spending time in nature, those are two things that I'm doing at the moment.
Okay, this is again another difficult question. But number one is that no one can say that he or she is stress-free, right? Your work, your daily life, and so on. The question is how do you manage that, right?
And the degree of stress.
Yeah, I think I can differentiate between working hours and family hours. Most of the time I don't bring, if it is not emergency or urgent, bring work to home, to do work at home. That's what I've been trying as much as I can. Definitely I do exercise regularly, except during winter time. It was, so cold. I cannot do exercise. Luckily I have my wife with me as well, and then she always prepares good food. Healthy food nowadays, we talk about healthy food. And good, working in a very good society, good work team with the colleagues, and then leadership and interaction with good people like you, Jerry, and other UN colleagues. So that I think that's how I mean, look at life in conclusion, look at life in a very positive way.
Thank you. I start my day drinking hot water with turmeric.
Oh.
And then do, of course, my prayers and meditation and a lot of gardening these days, which keeps me fit. But no more on personal life here. But I'd like to conclude the session. And normally we ask our guests to choose some titles. But then today, because we are focusing on COVID, we decided not to distract the conversation with book titles. And then I end the session with the Bhutanese wisdom or some saying or proverb. I think, as Jerry pointed out earlier, there are almost close to 300,000 people who have lost their lives, and then about 4.5 million people who have been infected, and many loved ones, many people who have lost their loved ones. So I think we should send out our heartfelt empathy, not just sympathy, and prayers to all of them. And and for those who are stuck at home or in quarantine centers, I always request people to be a little more patient. I'm somebody who believes that every cloud has a silver lining, and I think I found a Bhutanese proverb coming from spiritual master along the same lines. So I'll share that. Barche nidukki nadin. Misfortunes are harbingers of even greater blessings. So maybe this misfortune is something from which we can learn a lot and receive a lot of blessings. So thank you. Thank you for joining us online.
Thank you very much. Thank you.